Well, hello and welcome to our webinar. We really appreciate everyone taking the time to join us for this important topic. Today, we're talking about insights to protect the physical and emotional well-being of technology employees as we navigate COVID-19. I'm Louisa Destin. I'll be your moderator for today. I'm a senior editor at Travelers in Integrated Marketing, where I get to work closely with all the panelists that you'll meet in a moment on articles, videos, and other content that can help our customers protect their employees and their business. And there really has been no bigger story this year than the response to the pandemic. So today we're going to talk about the physical and procedural changes, and we'll also discuss social and emotional effects of returning to the office. And whether your employees are continuing to work remotely or are planning to be back in the office, we'll talk through some potential cyber risks that tech companies might be facing. So start thinking about your questions. You can submit them in the Q&A function during this presentation, and we'll take them at the end. So we think that today you're going to come away with some really actionable steps for reopening and maintaining a healthy office. So panelists, I'll let you introduce yourselves, and then we'll get started, starting with Kirsten.
Hi, my name is Kirsten Simonson, and I am the Professional Liability and Cyber Insurance Product Strategy Lead for technology companies at Travelers.
Hi, I'm Marcos Iglesias, VP and Chief Medical Director, and I work in the Workers' Compensation group, leading a medical innovation and strategy team.
Hello, everyone. My name is Courtney Phillips. I am a Senior Risk Control Consultant and also the Risk Control Liaison for technology here at Travelers.
Great. Well, thank you all for taking the time today to talk with us. We look forward to getting started. So let's switch to Dr. Iglesias. We have a question for you as we think about what are some of the unprecedented challenges that employers are facing as it relates to the mental well-being of employees as we think about going back to the office?
Thanks, Louisa. Yeah, we are living in unprecedented times, that's for sure. And you know, there's a lot of uncertainty, there's fear, there's anxiety. And I think that both the breadth and also the depth of the threat itself, but also a confluence of issues. There's the pandemic itself, of course, but an economic downturn at the same time. There's social isolation, relentless media attention, and even social unrest. All of these things are contributing to expose us to mental distress. And I think that no matter who we are, we're all susceptible to it. There was a survey earlier this year that showed that 2/3 of us who are employed are reporting higher stress levels since the pandemic broke out. We're also filling more prescriptions for anti-anxiety medications, for anti-insomnia medications, and for antidepressants, according to Express Scripts. And then we have this study that was published in the Journal of the American Medical Association last month. And what it shows, it's a comparison of the situation in April of this year to 2018. And what it tells us is that 14% of us, of US adults, are reporting serious psychological symptoms in April of this year, compared to only about 4% in 2018. Additionally, about 14% of us also are reporting serious levels of loneliness. So we have loneliness, we have stress, we have psychological distress, and all of these things can seriously affect our company's employees. And I think it's important to just state here that it's not just those who are employed, you know, those of us who are lucky to still be employed, but there's a lot of people out there that are underemployed, that are unemployed, and worklessness can have a serious effect on their mental health, and in things like stress and things like suicide, mental health conditions. So that's the situation we're facing today.
It's certainly something that is almost nearly universal in terms of the far-reaching effects of it. So
yeah.
Things that might be happening at home can certainly come into the office. So how can employers recognize and help alleviate some of these emotional and social issues as employees start reintegrating back into the workforce?
Sure. And I think this is where managers and supervisors have a very important role to play. As manager, supervisor interact with employees, whether it's in person or maybe even still virtually, they're going to have an opportunity to identify those individuals who may need some help. And I want to underscore here that most of us are going to be fine, even in a situation like today's. Some of us might even come out of this more, stronger, more resilient, but there are going to be some of us who need that extra help. We're not doing terribly well socially, we're not doing terribly well emotionally. And I think that's where a supervisor may be able to help that person who needs a little bit of extra psychosocial help. And I think a very simple way of doing that is simply by asking the question, are you okay? So, hey, are you okay? It just opens the door to better communication, more open communication, but it also may help that supervisor identify the individual that needs that help. And I think the important thing here is to remember, don't assume somebody's going to be okay or not. We don't know. The important thing is to ask. And then having asked, have the resources available to point that individual to some help. That help might be in an employee assistance program. It might be community resources. It might be a national resource that helps with a particular problem that they've identified with the employee. So ask, are you okay? I think it's a great way to approach this. And I've had a lot of people say to me or ask, is it okay to ask? And I think it is. I think it is. There was a survey done by Qualtrics this year that shows us that employees not only are okay, they're comfortable with their managers asking, but a lot of employees actually want managers to ask. So don't be shy, make sure you ask.
I think the beauty of that question is so open-ended that the employee can take it however they want, right?
Absolutely.
They volunteer.
Yes.
If they choose to. So that's a really helpful point. How would you say employee and mental health and physical health are connected?
Well, I think of health or well-being in a biopsychosocial context. We're biological beings, but we're also social and emotional beings. And our psyche affects our body affects our psyche. So stress can certainly lead to medical issues, biological problems like heart disease, like gastrointestinal problems. A lot of other what we would consider medical problems are caused by stress. I think that this year there's an additional concern, and that is that a lot of us have been afraid of the disease. We're afraid of getting the disease, and so we've been avoiding medical care for things that are chronic conditions. And so that's an aspect that again, fear is impacting our medical or biological self. And I think that lastly, we need to be careful because stress, mental health conditions can also lead to social and workplace issues. Interpersonal conflict, decreased productivity, things like absenteeism, or just a negative environment. So we really do need employees that are at their best physically, emotionally, cognitively, and socially.
Mm-hmm. I know we've talked about something as simple as not getting enough sleep as a result of stress can have far-reaching effects. So
a lot of us are dealing with that.
Right. Courtney, how would you, about from a risk control perspective, what are some considerations?
Yeah, from a risk control perspective, I would just add it's important to recognize all of these issues when you're bringing employees back to a work environment that it might look a little bit different. It might be operating a bit differently than when they left or than what they're accustomed to. So employers should really try to communicate on the policies and procedures that have been developed in response to COVID. Try to communicate on those early before employees return, and then try to train as soon as possible on those procedures upon their return. Keeping in mind that employees are coming back with varying levels of comfort or discomfort, and so the preparation, the communication is really important as it relates to their health and safety. So that is something that you want to keep in mind. Also, I would say having a contact person and making sure that everybody knows who that is, so that if employees do have questions or concerns that they want to talk about, that they know who to reach out to, and then striving to create an environment where they really feel comfortable doing that if they need to.
So it really sounds like that communication is important both for the physical and emotional well-being, just making sure employees know who they can talk to and then it's safe to do so.
Right. Mm-hmm.
So as tech companies are preparing for reopening, what are some of the key back to business hygiene and safety protocols that employers should be mindful of?
Well, there's many considerations to be made when contemplating reopening and bringing your employees back, and that's going to look a little bit different for each company, but we really recommend that employers refer to CDC guidelines, OSHA, as well as any state and local guidance that is available to help decide when and how to bring your employees back safely.
So the slide that we're looking at right now shows us the Traveler's Path framework. Can you tell us a little bit about what that?
Sure. So Travelers has developed a framework called PATH in an effort to really help employers focus their efforts as it relates to their reopening strategies. So PATH stands for Plan, Act, Train, and Health. So we can go through each of those elements in a little more detail, and I'll talk about some risk management strategies and some controls that you can consider to help reduce the risk of transmission in the workplace. So starting with plan is really about understanding your level of risk as it relates to your operations, but then also as it relates to other factors like the conditions in your community. Employers should be assessing the work areas and also tasks in their workplace to determine where they can achieve physical distancing between employees, and then also identify those areas that are going to be challenging. Once you have an understanding of the level of risk in your facility, then you can more effectively evaluate potential controls, which that brings us to ACT.
Which is generally a hierarchy of controls that you need to consider.
Right. So there's a hierarchy of controls really categorized by level of effectiveness. So we can go through those. We would start with elimination, like eliminating a hazard. Well, we can't eliminate COVID-19, but we can remove or reduce some risk. For instance, maybe you could eliminate access to your facility for visitors or vendors or non-critical contractors. Another option to consider would be to reduce or remove some risk by maybe having a portion of employees continue working from home, just reducing the number of employees in your facility. So that would be some examples of elimination, and then we would move on to substitution. And a couple of simple examples there would be holding virtual meetings instead of in-person meetings, or possibly using electronic signatures instead of written signatures for deliveries, for example, just to reduce some contact. So that would be substitution.
Changes that can help cut down on unnecessary risk.
Contact between people. Yep. And then next in the hierarchy, we'd move to engineering controls, and many people are familiar with engineering controls, which really sort of interrupt that transmission pathway. So that would include things like partitions or barriers between employees, maybe reconfiguring a work area to achieve more distance between people, sensor activated doors, water fountains, sinks, those would be considered engineering controls. And then next on the hierarchy, we move to administrative controls, which require a bit more participation. In general, these would be the policies and procedures that you've developed in response to COVID, and then also the communication and training around those procedures. So that is what is involved there. So that could include signage on hand hygiene, for example. Might also include just training on your cleaning and disinfecting protocol, or your screening protocol, and so on. And then once you've considered all of these controls, and we also want to consider face coverings.
I think it's interesting that many employers, when they think about returning to work, face coverings might be the first thing that comes to mind. But
sure,
you noted there's a lot of preparation that needs to happen first, right?
Right. If we think about like personal protective equipment in general, generally speaking, we would recommend PPE when other controls are not feasible or when they're not effectively reducing exposures, not generally as a first line of defense. So, PPE doesn't remove a hazard. It also just is dependent on the wearer to use it correctly. So there's room for human error there. So similarly, when we think about face coverings, we want to consider that in addition to the other controls that we've talked about. And then of course, just keeping in mind any state or local requirements. Like some states might be recommending face coverings, while others, it might be mandatory.
Interesting. So training, I know, is next on the list, and I think some of it really speaks to what we were talking about earlier, communicating with employees so they know what to expect, especially now that times are so uncertain. That's right, Courtney?
Yeah, right. That's right. So training is the next element in the PATH framework, and you want to just train as early as you can when employees return, and that can be challenging. And it's hard. We can't all probably sit in a conference room together, shoulder to shoulder, and go through training. So employers might have to get a bit creative when it comes to their training solutions. But certainly, we want to train early. You stand to have better buy-in and adherence to policies when employees are really clear and understand what the policies are and understand the expectations around those.
Well, that makes sense. Cleaning and disinfecting are also top of mind, both at home and at work.
Yep.
Can you tell us
Right.
health considerations?
Sure. So health is the final element that we'll talk about in this framework. That can include your cleaning and disinfecting protocols. So cleaning according to CDC guidelines and with recommended products is really important as we talk about, interrupting that transmission pathway. Also in health, that would include things like wellness screening. So if you are doing any screening for employees or vendors, visitors as they come into your facility, doing that screening might be one way to gauge work readiness for employees as they're coming back and each day into the workplace. Might include temperature monitoring, could include having them fill out a questionnaire, answer some questions around symptoms, around having contact with individuals who have symptoms or who've been diagnosed with COVID-19. So that would fall into that health category too. Like with face coverings, so we don't want to over rely on screening. We want to do that in addition to all of the controls that we talked about earlier. And then also, I would consult with a medical professional and legal counsel before you implement the screening policies and procedures. So that's sort of all of the elements of the PATH framework. And then once you've got a plan in place and you're following that path, you really just want to monitor and make adjustments or revise as necessary from there.
That seems like a really comprehensive way of looking at things as we look at the physical space. Certainly, as we've alluded to earlier, there may be tech firms that choose to maintain remote work going forward. So, Kirsten, how can employers prevent and recover from cyber threats introduced by these new work routines?
Yeah, as more and more employees have been working remotely, the importance of maintaining good cyber hygiene continues to be important, and might be a good time for some updates. Similar to what Courtney talked about, preparation, prevention, and training continue to be the key components to managing cyber threats. Companies should have prepared or be prepared to respond to a cyber event by developing a cyber incident response plan if they haven't already done so, or reviewing their existing incident response plan. Like I said, this is a good time to test that existing incident response plan against the new normal. Despite all the measures taken to manage information and network security, it is still quite possible that an employee may inadvertently bring a compromised device into the network or be snagged by a phishing attack, especially if working under unusual conditions. And when you think back to what Dr. Iglesias was talking about earlier, if people are feeling more stress or more depressed, or they're in a job that they're unfamiliar with, that may open them up to not recognizing some of those simple things to look out for. Some of the proactive security measures that should be reviewed include strengthening or establishing a strong remote access protocol, including things like requiring connection to a secure network and use of a company-issued virtual private network or VPNs to access any work-related accounts. limiting access to the company network to only the company approved or vetted devices and applications, and not allowing individuals to substitute tools or applications that have not been vetted with their own preferred tools or applications, and further require multi-factor authentication for all remote access. We talk a lot about training, and it's just as important here to continue to engage and train employees to maintain diligence. Now that they're not working in the corporate setting and connected directly to the network, they become a more critical part of the cybersecurity team. We know that cyber criminals have been taking advantage of COVID-19 and everything that's going on and crafting tactics to target these remote workers. So additional training on how to spot phishing emails or respond to other forms of social engineering may be warranted. Some additional steps the individual working remotely can take is to make sure their home Wi-Fi network is secure. And if other members of the family are also at home spending their time on the internet, educating employees on how to create a virtual network may be a great option for keeping work separate from the rest of the home's internet traffic. And if they haven't already, at some point, we expect employees will begin to come back into the corporate environment. So it's just as important to have a plan in place to make sure the devices they bring back into the workplace are clean. And one option to think about to increase defenses is deploying an endpoint detection and response solution, which can help protect and monitor every asset on the enterprise network by identifying suspicious activity before the rest of the corporate network is exposed to unnecessary risk. You know, we've heard this or said this many, many times over the past few months. We are all in this together, and cyber hygiene is just another critical part of that conversation.
So interesting. I think the idea of coming back to work presenting risks, right? You think that's when you're safe is when you have everyone back within the walls of your organization, but just being aware that there could still be threats that persist.
Yeah, we don't always know what the employee is connecting to, if it's a public Wi-Fi or just everyone in the family is on the network. And so who knows what is lurking in that laptop when you bring it back into the office.
Good advice. So this next question, certainly for all of you, from a social, emotional, physical perspective, how do you think that COVID-19 has changed the way that employers will think about maintaining healthy offices going forward? And are there any new practices that will become part of the new business as usual?
So I can certainly get us started there. Go ahead, Courtney.
Oh, I was just going to say from the physical environment standpoint, physical workplace, we talked a bit about cleaning and disinfecting protocol, and I think there's probably just an overall heightened awareness as it relates to general housekeeping and cleaning, and it's possible that we may see some of these revised procedures or increase in frequency of cleaning, that type of thing. We might see some of that stick going forward.
And that's a good thing, right?
Not a bad thing necessarily.
Yeah, right.
Yeah. You know, and Courtney, even along those lines, you know, respiratory etiquette, right? We're going to be more careful. You know, when we have something as simple as a cold, never mind COVID, right. but those things are going to change. I think that for me, one of the very encouraging signs that I've seen is this emphasis on psychosocial well-being. Right? It's not something that we've talked a lot about before, but now we're introducing into our language things like, you know, a social call. That's okay to do in the workplace. It's okay for an employer, for a manager, for a supervisor to ask questions. It's okay to beef up the mental health resources that we have. And that might be just through mental health benefits for our insurance plans, all the way to, you know, making things available in an employee assistance program, lunch and learns that deal with managing stress, with building resilience, apps that help us to sleep better, that help us to deal with stress. So I think that the focus on those things, in addition to all the physical, is something that I think is very encouraging. And I hope, and I'm pretty confident that this will be something that remains with us for a very long time.
Yeah, that focus on the whole employee and really we've gotten a chance to get to know people in a deeper way in some sense, and it stands to reason that as people return to the office that some of that connection can remain and can be a healthy thing.
Yeah. Well, even right now we're coming into each other's homes. We wouldn't have done that 6 months ago, and I think that's good.
Mm-hmm. Very good. So I know some of you have been submitting questions as we've been chatting here. Certainly you can still submit some and we'll get to them here. The first one looks like it's for Courtney. So a significant number of our employees continue to work from home. What type of guidance should we be providing on ergonomics?
Okay. Well, one thing I would suggest is to try to encourage employees to have a designated workspace in their home if at all possible. And then another thing I think is if you can provide information around just working with neutral postures as a general awareness, but then also to help them set up their workstations accordingly at home with some simple tips. A couple of things, just on how to adjust or their seated height at their workstation and being able to key and mouse with their shoulders relaxed and at their natural elbow height and with their wrists straight.
Mm-hmm.
Other tips like, raising your laptop screen if you don't have a monitor so that you're not, neck bending, looking down at the screen, and then using an external keyboard and mouse to maintain the neutral posture. So these are just a couple of examples or suggestions, but we actually have quite a bit of information. Travelers has published information on our website on just managing a remote workforce, and there's lots of tips on there for home office workstations. So I would recommend just taking a look at those if you get the opportunity at travelers.com.
That's great, thank you. Yeah, and certainly folks maybe that worked from home one day a week, you might have been able to get away with your kitchen counter, but if you're home, having the right ergonomic setup really can help.
It can make a big difference. Yeah.
Exactly. So Dr. Iglesias, this question is for you. You mentioned the health consequences of unemployment. Could you tell us a little bit more about that?
Yeah, so think of it this way. When you compare two different populations, one who's employed, one who is not, there are significant differences. And obviously, financial, economic, social, we talked a little bit about emotional differences and psychological or psychiatric illness, much more prevalent in the workless population. But there are also physical consequences, medical consequences. We know that the unemployed or workless population has an increased risk of poor health, roughly about 2 to 3-fold increase in risk of conditions like respiratory infections, one that we're dealing with right now, but also things like lung cancer and heart disease. We talked about the mental health disorders. There's about a 6-fold increase in suicide rates. That number is actually much, much higher in young males who are unemployed. And there's increased risk of substance abuse, of alcohol abuse. We have a shortened life expectancy if we belong to that workless population. So these things are not insignificant, and I think it's something that we're going to need to be watching out for, especially as a large portion of our population today is not working. There was a study a few years ago that compared the physical consequences of worklessness to smoking. And it would take a 10-pack per day smoking habit to equal the risk, the medical risk of worklessness. So it's significant, and it's something that I think we need to pay more attention to.
Mm-hmm. Certainly questions like asking employees if they're okay and helping them stay engaged in the workforce become, more important and potentially a life-saving question. So that's really helpful.
You may have neighbors or people that you love that are not working. So make sure you're looking after them and go ahead and ask, are you okay? That's a good way to start the conversation.
This next question, cyber question. Do you have any examples of the slickest phishing scams that have come out of the COVID-19 environment? So, Kirsten, this one's for you.
Probably the slickest one I've seen recently is the Twitter hack, where Bill Gates and others were allegedly asking us to donate Bitcoin. But I don't know about slickness as much as the criminals understand human behavior, and they understand that we all want to help, or we want to feel better, or whatever it is. And so you would see phishing scams that would purport to be from the World Health Organization or local governments or whatever it might be. Hey, help us, donate money, donate this, click here for the most up-to-date COVID information.
Mm-hmm.
And, when you think about the pressures that employees are under as they've been scrambling to readjust to this new lifestyle, if they're not paying attention, it's very easy to click on one of those and get snagged by them. And, I remember in the old days when we would train, a decade ago, we would train people to watch for the typos. The typos really don't happen unless you're very closely paying attention to the URLs. They look very, very legit. And, I get some, and I recognize that it's coming from an external party and that it's not legit, but we'll sit here and stare at it for quite a long time, just impressed at how easy it would be for so many people to buy into the message that they're sending.
Right, and so that being in a rush certainly can be a costly mistake. So training employees to slow down and be cautious.
And even recognizing the simple things, when you're doing business with a certain vendor and you get an invoice and they've changed bank routing numbers, don't just take that as being correct. You have to really question things like that and, talk to the source if you can to make sure, yeah, this is legit.
Mm-hmm. We had another related cyber question. Are there any cyber risks for tapping into personal hardware, like using your TV as a monitor while it's tapped into a separate streaming device like a Roku or Apple TV?
There certainly can be. I mean, a lot of that will depend on how well that particular device is updated to the most secure. I see oftentimes that people don't change the default passwords when they get a new device. Well, your default password is basically out there for anybody to look up. And if you haven't changed that, the criminals can have access right into your devices. So all of these Internet of Things, as we call them, IoT devices, can be an access point for the criminal if they're not managed correctly. Absolutely.
Courtney, this question just came in about the difference between a face covering and a respirator. Could you help folks understand the difference between the two?
Sure. Respirators are NIOSH approved for protecting employees from inhalation hazards, potential inhalation hazards. So for instance, an N95 respirator is approved to filter airborne particulates. You might see that used in the workplace for maybe reducing exposure to like wood dust or maybe welding fumes. Right now, as it relates to COVID, CDC is only recommending those for healthcare workers.
Okay.
Other face coverings, like for instance, like a cloth face covering or a surgical mask, they're not approved respirators. CDC still recommends them though, because what they can do is possibly interrupt that travel path for the larger respiratory droplets, and hopefully help, prevent someone who may have COVID-19 from spreading it to others around them.
Okay, that's very helpful. Thank you.
Sure.
Related question to that too, do we need to have a formal respiratory protection program in order to require employees to wear face coverings?
So as I mentioned, like with the N95s being an approved respirator, you would need a program in place for those. But again, currently those are recommended for healthcare workers. The other face covering, so face covering is kind of a broad term. It could include an N95 respirator, but also could include cloth face coverings, surgical masks, maybe even a plastic shield. So those other face coverings are not approved respirators, like I mentioned, and they fall outside of the requirements, OSHA requirements for a respiratory protection program.
Very good, thank you.
Mhm.
Dr. Iglesias, we have a question here about the, what happens if the "are you okay" inquiry ends there? So you can sense that things might not be, but the employee is not willing to open up.
Yeah, great question, Lisa. Whenever we ask a question like this, it's one that we need to do with a lot of sensitivity and respect. We are asking something that is personal, and some of us may respond very well to that. Some of us may not, for a number of reasons. Maybe it's who we are, maybe it's our background. And so I think that whenever we ask that question, we need to understand that, first of all, and be willing to just say, hey, I understand that you don't want to talk about this, and that's okay. But if you ever do, I want to leave the door open. And if it's not me, maybe it's someone else. Maybe it's maybe it's one of your coworkers, maybe it's somebody in HR, or just point that person to to leaving the door open to this conversation continuing. And I think that's important. It will still make that person more comfortable with the idea that you're there, that your company's there in order to help them. So don't shy away because you might get that type of response. In fact, expect that response from some people, and welcome it because it's still advancing the communication.
I think that's a good point. We've talked in some of the articles that we've written about training managers and supervisors to recognize signs of distress and even preparing them to get that kind of reaction, right? And that's okay. That if people aren't ready to talk, not to take it personally, and not to have that be have a chilling effect from asking that question of others in the future.
Yeah, like you said earlier, it is a very open-ended question, and you may get no response, or you may get something that you're just not prepared for. So, think it through. Have the resources available at your fingertips, or know where to look for them, and then just be a friend. I think that's great.
That's great. So it looks like we are nearing time, and those were our questions for today. We had, I think, a very helpful and wide-ranging discussion. So I thank all three of you for your excellent suggestions and insights. The conversation continues on travelers.com. We have a lot of articles and other content there that can be helpful. You can contact your Travelers rep for more information, and we will be sending a copy of this presentation soon to anyone that was registered for this. So we thank you all for joining, and good luck to everyone as we all navigate COVID-19 and look forward to seeing one another in person in the office soon. So thank you and take care.